Well, a groundbreaking study estimates nearly 1 in 100 Americans have inflammatory bowel disease in the U.S. Up to 56,000 new cases are diagnosed each year, and the disease can be a burden in everyday life for those who suffer from it, which is why we have invited pediatric gastroenterologist and medical director of pediatric specialties with Bon Secours, Dr. Praveen Selvakumar. Thank you for your time today.
I'm happy to be here to talk about this important topic.
I was going to say, this is a really important topic to a lot of people. I know a lot of people who are dealing with this. I know people at home probably do as well. Let's start with the basic. What is Crohn's disease?
So Crohn's disease is a type of inflammatory bowel disease. It can cause chronic inflammation in any part of your gut. Exact cause of Crohn's disease is not known at this point of time. But currently the hypothesis is that a combination of environmental factors, genetics, and gut bacteria play together to trigger an abnormal immune response. Then the immune cells, which are supposed to be protecting your body, start attacking your own gut, thereby causing Crohn's disease.
And this can be painful, uncomfortable. You may need a bathroom around. People get very, very sick when it's out of control.
Yes, that's right. So the symptoms also differ from one child to another child. But the most common symptoms that we see patients are with abdominal pain, diarrhea, blood in the stools, poor appetite, and weight loss. And some of these kids can also have unexplained joint pains, mouth sores, and rashes. Some unique features that we see in pediatric patients are delayed puberty and poor growth.
So in children, what is the age that people should maybe look for this? Like, when does it start to show itself?
It's a good question. So as you alluded to initially, at this point of time, over 500,000 of people living in the United States have Crohn's disease. Of this, 25% of them have developed Crohn's disease before they turned 20, which means they were children and teenagers when they were diagnosed. As such, Crohn's disease most commonly affects people between 15 and 35, but it can happen in any age group. And the recent data has been showing increased incidence in children, including children who are younger than 5 years of age.
Is there any big warning sign in a child? Say you have an 8-year-old, a 9-year-old. Is there anything that you should go, let me go ask somebody?
So initial symptoms, you're right. So initial symptoms could be very mild, could be very non-specific, and that might lead to delay in the diagnosis. But the red flags usually we see in kids that we need to screen for Crohn's disease are the weight loss and poor appetite, decreased nutrition, growth failure, and the delay in puberty. That's when we seek medical care to diagnose Crohn's disease.
How is it diagnosed? Is there testing involved?
So when kids come to us with like signs and symptoms of Crohn's disease, we obtain blood test, stool test, and perform endoscopy and colonoscopy. The labs can show anemia, elevated inflammatory markers, and endoscopy and colonoscopy can help us to determine if there is any active inflammation in the gut, and also will help us to determine the severity and the extent of the disease.
All right, and what treatment options are available, specifically Bon Secours, for children diagnosed with Crohn's disease?
While there is no cure for Crohn's disease at this point of time, we have good treatment options, and the treatment options may vary from one child to another child. But our primary goals of the treatment are to decrease the symptoms and improve nutrition, thereby promoting growth and weight gain in these kids, and also to achieve healing of the intestines. At St. Mary's, we have an excellent team, a multidisciplinary team of like physicians, nutritionists, social worker, and nursing coordinators to take care of these children. Medical options are the primary treatment option for Crohn's disease. We use medications to calm down the immune system, and sometimes we have to use steroids. And we also use medications called biologics that block the inflammation in the gut, and which has drastically changed the landscape of treatment in Crohn's disease. We are able to achieve remission in majority of children, and thereby preventing subsequent complications.
Dr. Selvakumar, thank you so much for your time today. This has been really helpful, I think, to a lot of people listening who may go, oh, maybe we need to get it checked out here.
Okay, thank you.
Yeah,
thanks for inviting me here.
Yeah, thank you.